Hi, everyone. I'm Laura McGaldy. I'm the Viral Hepatitis Department Manager here at Philadelphia Fight, and I'm going to share my screen with you. Today, I'm going to talk about the importance of comprehensive care outreach and navigation in the community setting. Some of the things we're going to talk about are a review of the traditional ways that we've tested for HIV and hepatitis C in the community, the ways that we've navigated people traditionally to care, the importance of expanding services to include individuals who may not be aware of available resources, and also some strategies for changing counseling and educational messages provided to the community. The program that I work with here at Philadelphia Fight is the See a Difference team. We are a hepatitis C and HIV testing, education, linkage, and treatment program housed here at Philadelphia Fight. We partner with community service providers to make sure that everybody who is receiving services with those providers and working with those providers all have access to the gold standard of medical care, whether they're living with HIV or hepatitis C or at risk for hepatitis C or HIV. We want to make sure that everybody knows everything that's available to them. And every single person that we come in contact with are eligible for navigation services, primary care, dental care, and subspecialty care, either here at Fight or if somebody really loves their medical home, we'll make sure that they know how to get in touch with all of the right providers there. I want to share our mission statement of the See a Difference team. We were founded to provide comprehensive, patient-centered, whole-person healthcare services to individuals in Philadelphia and the surrounding area who are living with or at risk of contracting viral hepatitis, HIV, sexually transmitted infections, and those experiencing complications of unstable housing, poverty, substance use disorder, and other factors contributing to healthcare disparities. But we also treat a lot of folks that aren't necessarily living with a lot of disparities, but just want somewhere that they feel safe for their medical care and that they can access all of our services. Our testing program, I hate these animations, I'm sorry guys. Our testing program here is, we do testing in drug treatment programs, homeless shelters, medication-assisted treatment centers. We also provide cure at all of the Philadelphia Fight Health Centers, the Jonathan Lax Treatment Center, which serves folks living with HIV, the John Bell Health Center, which serves folks all comers. If you're a human being and you need healthcare, you can get care at the John Bell Health Center. Broad Street Ministries, which is located down the street. We have a clinic there. The Youth Health Empowerment Project, which is our adolescent healthcare clinic. And we also do a lot of telehealth care with our partnering agencies. So folks who can't come in to see us will have an iPad set up where they can contact our doctors. So they can have just a regular medical visit that's remote, kind of like everybody was doing during the COVID pandemic. We are continuing that because we know that some people just can't make it downtown for their care. We want to make sure that they're still getting the best care possible. Excuse me, Philadelphia Fights Institute for Community Justice and the Philadelphia Department of Prisons testing and linkage program is also part of our programming. We want to make sure that everybody who is coming through the Department of Corrections here in Philadelphia has access to HIV testing, hepatitis C testing, and appropriate treatment. I want to talk a little bit about traditional HIV and hepatitis C rapid testing and navigation models. These are the slides that I made nearly 10 years ago. So I wanted to keep the colors. I wanted to keep just how kind of fundamental it was. I think that most people on this call should be familiar with this. The individual wants to be tested. They sign the consent. If somebody signs the consent, we test them for hepatitis C. And then those antibody results and a counseling message will be provided. If they don't want to consent, we'll talk to them about how they can access care, maybe how they can get tested somewhere else, and how to either keep from getting hepatitis C or keep from spreading hepatitis C. And if a person does test positive, we would have to wait for a confirmatory test. So when that finger stick test would come back, we would do a blood draw. The provider who is ordering it, so usually a doctor here at Philadelphia Fight or another testing site, would receive those confirmatory tests in their medical record. They would have to let the linkage the linkage coordinator know those results. And then that linkage coordinator would either have to call the patients for the results or call the original test site with the results. where the test site staff might have to support the patient into getting into care. We'd have to look at insurance status, whether, excuse me, whether somebody had a PCP, whether they had insurance. It was kind of a really lengthy process to get them into care. And similar with HIV, the person wants to be tested, they either consent or don't, they're tested or not. And then the linkage process was to develop or to come up with an immediate care plan where the patient would accept care and we'd need to get them into care, or they wouldn't accept care and we'd give them a counseling message. So it's kind of a long drawn out process, especially for the hepatitis C testing. It could take weeks for those results to come back. Now we know that HIV testing comes back the same day. So those rapid tests for HIV is a rapid test and your results come back in a minute, but the hepatitis C could take weeks to find out whether the person needed treatment or not. So, we know that education, counseling, and testing in the community is the first step to the path of elimination. We know that outside of rapid testing, a primary care provider should follow those CDC guidelines for testing, even if they feel like they know their patient or they feel like they can tell if there's a change in their patient or their patient is ill. We see that a lot with doctors everywhere. They'll say, oh, I know my patient so well. I know they're not at risk for HIV, or I know they're not at risk for hepatitis C or STIs. But the only way to know that you have an infectious disease is to be tested specifically for that disease. So liver enzymes, blood counts, flu-like symptoms, those are not indicative of infection. And a lot of people are infected and they have no idea for several years. And then for people who can't or do not seek primary care, it's really important to keep that community-based testing, those rapid tests, and jail-based testing programs, just to reach those folks who are at greatest risk for HIV and hepatitis C. So even though we know that this traditional rapid testing model is a little bit drawn out, it's still important. So we know that hepatitis C and HIV screening is not always routine for a lot of people. We know that a lot of people are uncomfortable about seeing their regular doctor about infectious diseases, especially if you share a primary care doctor with your partner. You might not want to get tested for something that you would have to later explain to the partner. You'd be worried that the doctor would explain, or you'd be worried that your doctor would share with the partner. Some people are not comfortable seeing a doctor at all. There's a lot of misinformation out there. There's also an increasing number of citizens who are undocumented and uninsured and don't know that care is available to them. About half of the people who are living with Hep C are aware of their diagnosis, and high-risk behaviors can increase the risk that someone may either spread or become infected with Hep C or HIV. So we really want doctors to test and other providers, and we also really do want that community-based service to stay. There are also some safer protocols and streamlined alternatives to rapid community testing for Hep C and HIV. So we know that it takes about 30 minutes to complete that session, and it's done face-to-face in a closed space, which used to work great, but now we've lived through a pandemic and not everybody is comfortable sitting face-to-face with somebody for a half an hour, especially during like cold and flu season or when COVID numbers are up. We also struggle with privacy in a community setting. When we're working in a shelter or a recovery house, we ask for a private room, but sometimes those walls are paper thin. Sometimes those walls are just dividers. So when we're with a client in the community, we might say, hey, I have these rapid tests and I can give them to you. Or we can just link you with a provider right now. We can get you to the doctor. They'll test you for HIV. They'll test you for Hep C, STIs. They'll also get a complete blood count. They'll listen to your heart. They'll feel your belly. So it's really important to get people into the doctor so they get that whole person care. A lot of people just want that rapid test, and that's totally fine. But we really do urge people to know that that's available for them. When we do group counseling and group education, the messages are still definitely there about HIV and Hep C testing, but also, your mental health is important. Your financial health is important. What if you need to be connected with a benefits counselor or somebody who can help you out with other things? Here at Philadelphia Fight, we offer so many comprehensive services that we want to make that time with the patient or the client in the community just really, really all-encompassing of everything that we have here and they deserve to have. And again, Fight providers, they screen for everything. And then regardless of health status, regardless of whether you test positive for anything or not, you're going to be offered continued primary care services, supportive services, behavior health support, medical case management, dental care, re-entry program, and everything else that we have here. Then with patient linkage and navigation, we don't stop just with that rapid test or just with that test that your doctor runs. We like to do a lot of well checks with our patients at all points of care and beyond to let them know that we're thinking of them. We want to make sure that they're getting what they need. We know that we have everything here at Philadelphia Fight and beyond with some of our other partnering providers, but we really just want to make sure that the patient is getting everything that they need and make sure that they're comfortable sharing their needs with their providers. We collect a lot of alternative contact information for our patients if they sign that consent to do so. Sometimes people's phone numbers change, sometimes people's emails change. So we want to know, where do you get your hair cut? Where do you like to hang out? Where do you work? Where are you most likely to get mail? Maybe that's at your mom's house or your sister's house. So that's a really important part of testing, not only to deliver those results if we have to wait for something to come back from the lab, but if somebody falls out of care, we want to make sure that we can find them and re-engage them in care. We do a whole lot of street outreach in our most vulnerable neighborhoods. The one that most people know is about is Kensington, but there's also some spots in South Philly, Southwest, North Philly. We look for patients, we look for clients, we look for other people who might recognize the Fight logo that we have on our t-shirt or the little kits that we're giving out. And they say, oh, you're that guy who I talked to in jail, or I talked to you when I was at X, Y, and Z program. It's just a really good way to stay out in the community and stay in touch with everybody that we serve. We also partner with a whole bunch of social service organizations and public health provision agencies just to increase the likelihood that we're going to re-engage with people. So if somebody maybe accepts a rapid test, they test negative, they don't accept linkage to care here at Fight or somewhere else, we can say, hey, we're back, we're still out here, we're still thinking about you, is now the time. So keeping that engagement going out in the community is just so, so important. It goes way, way beyond just that 60-minute finger stick test for HIV. We also keep really close contact with the Department of Public Health hepatitis surveillance team just to assist with identifying the needs of people who might be lost to care for us. So we want to know that if Joe Smith was missing his medication appointments here, maybe he just went somewhere else because he moved or he didn't feel comfortable coming downtown for whatever reason. So the Department of Public Health can say, hey, Mr. Smith is just fine. You don't have to reach out to him. Or they can say, hey, Mr. Smith is not on our radar anyways. Maybe dig a little bit deeper into those contacts that you have for him. We know that there's a ton of barriers for people in care. It's not just not being comfortable coming downtown or moving. We know that people have comorbidities, they have competing priorities. A lot of people prioritize their children, or maybe they're taking care of an elderly person at their house. Unstable housing, lack of transportation, a limited knowledge of what you need to do if you're at risk for or living with hepatitis C and HIV. There's still huge stigma, unfortunately, around being diagnosed with an infectious disease. A lot of people living with some of the conditions that we treat have had really negative experiences in the healthcare setting. Incarceration happens, institutionalization happens. Some of the barriers with providers, we find very often that a lot of providers around this entire country don't have an interest in treating some of the patients. With our Hep C patients, we've had providers say, like, if he stops using drugs, then I'm going to treat him. It's not really worth my time to treat somebody who's just going to get reinfected. We know that that is absolutely 100% not true. We know that everybody deserves treatment, and we know that that every day that you don't have a virus, you can't give it to somebody else. So if somebody is using drugs and sharing works, we want to treat them so they don't have virus to give to the people that they're sharing with. Providers have concerns about adherence. The literature says that people who are injecting drugs or using other drugs have very, very similar results with their medications to people who are not using drugs. So adherence is not usually a problem for that population. Sometimes the provider sees some medical contraindications that they don't want to treat, maybe HIV or Hep C. They'd rather focus on something else. The providers have competing priorities. They have limited time with the patients. And then also we're living in a system. Insurance access is hard. We live in a system that is really not set up to take care of everybody. There's a lack of infectious disease providers. There's payer restrictions in some places for Hep C drug approval. And then there's a lot of payer requirements prior to drug approval. They want us to run 1 million labs. They want us to jump through hoops, fill out huge packets of information. So there's just a whole lot of stuff standing in the way of getting people treated. We want to make sure that we are working with everybody, with the providers, with the system, and with the patient to make sure that those barriers are lowered. One of the ways to do that is to kind of break away from these traditional referral models where all the drug and alcohol clinics would say, hey, just go to the doctors and take care of this. Primary care centers would go to a subspecialist and take care of this. Pharmacies would send to, this slide comes out of Australia. They call it a tertiary care center, but that would be something like Penn or Jefferson, like a big medical home where everybody's just sending people somewhere else to get their care. We know that we should be sending people out into the places where the people are to get their care. So instead of asking everybody to come to Philadelphia Fight goes out to the people. We're in the prisons, we go to needle and syringe exchange programs, we go to community health centers, and we do a lot of education, we do that testing, and we do that linkage to care work. Philadelphia Fight, we have a safe space for people to access culturally competent, comprehensive medical care, regardless of anybody's insurance status, ability to pay, or life circumstances. We know that that's not true everywhere. We know that even some of our larger hospital systems don't have the capability to take care of everybody. So we want to make sure that we have space to do that here at Philadelphia Fight. And we want to make sure that our team is out there letting every single person that will listen to us know that we're here for everybody. And care at Philadelphia Fight looks very unique, I think, to a lot of other places. We do individualized care. Harm reduction is practiced everywhere. Our teams talk. We have cross-disciplinary and multi-central huddles. And what that means is the nurses, the pharmacists, the navigators, the testers, and the doctors sit down together once a week and talk about every patient who is receiving care for hepatitis C here at Fight. And then we also have a lot of services that are right here for us. So it's not hard to navigate somebody to our on-site pharmacy care. It's not hard to get somebody re-entry support. It's all either right here in this building where I am now or a couple blocks down at our other building. So just really making it easier for folks. If you're not familiar with the John Bell Health Center, which is Philadelphia's Fight kind of all-comers health center, we do everything. You can get an exam, you can get your medical history taken, diagnostic testings, cancer screening, this whole laundry list of services. It really is a one-stop shop for your care. I would be sad if I couldn't do a little bit of Hep C 101, even though this is a training about getting away from those traditional models of just testing a little bit and, rapid testing in the community and getting somebody into care. I do want to share, this is relatively new information that every single person who's over age 18 should be tested at least once for hepatitis C. So if you haven't gotten your hepatitis C test, I would ask your doctor just to make sure to run that. There are other ways to get hepatitis C other than injection drug use. You could have a blood splash, you could have just anything that would put your blood in contact with somebody else's blood. You could do wound care, you could, knock into somebody on the street and help them up, and you see that they're bleeding and you're bleeding. So there really is reason for every single person to get tested for hepatitis C. In most of our major medical centers here in Philadelphia, it is folded into your blood work, but it's a good idea just to double check to make sure that your doctor checked the right box and made sure that you got that test. There's also two epidemics intertwined. It's called a syndemic. We know that 1 out of 3 people who inject drugs acquires hepatitis C infection in their first year of injecting. And a lot of that is because folks are sharing doses, they're sharing works, they are living, in a high-risk area, maybe on the streets or maybe in and out of recovery houses. Hepatitis C is the most common chronic blood-borne infection in the US, and anywhere between 45 to 85% of individuals who are chronically infected do not know about their status. So we see, you can see up at the top there, about 70 to 77% of the people who are injecting drugs have been exposed to hepatitis C. Now, whether or not they have a chronic infection, they'll need a test for that, but we know that that there's still a lot of Hep C out there. There's talk that Hep C is being eliminated and Hep C is on its way down. That's true, but only about 46% of people who are living with viral hepatitis are cured in the city of Philadelphia. So that leaves about 26 or 27,000 people who are still actively living with hepatitis C. Something else that's really important to know is that hepatitis C can live for up to 64 days outside of the body. It has a really strong envelope. It's not one of the viruses that just kind of like pops or dies when it's out of the body. It can live in a syringe for 64 days. It can live in a bottle of water that maybe somebody is using to inject or using to clean a wound if any of their blood gets in that water for 3 weeks. It can live for 3 weeks on a surface. So it really is important to know that anything with blood on it, and it doesn't even have to be a visible amount of blood on it, could have active hepatitis C virus on there. So that's why if you were to step on a needle out in the community, you're really going to want to go into the doctor and make sure that you don't have hepatitis C. It can survive really high temperatures. It needs to be heated for about 1.5 minutes at about 160 degrees Fahrenheit to ensure that the virus is killed. And these other pictures are just how much blood can actually be in a syringe. So you can see that there are some syringes that have very tiny amounts of blood, some syringes that have more, but all those needles that you may see in the community on the streets, hopefully in a Sharps container, but I know that they don't always make it there. There is blood in those needles if they have been used. Hep C can be cured. I think that that's a really important message that still needs to get out there. You can be reinfected though. So if you take your medication and you're all better, if you're exposed to hepatitis C again, you can be reinfected. So it's kind of easier to think about now that we've had COVID and we thought like, oh yeah, well, I'm all better. I got the shot or I had COVID, so now I'm not going to get sick again. Hepatitis C is very similar, that it's not a durable cure. So you can be cured, and as long as you're not exposed again, you're cured forever. But if you do have a blood exposure, then you do want to go get tested again, just to make sure that you don't have virus. Then a couple quick facts. Hepatitis C is a contagious liver infection caused by the Hep C virus spread through contact with blood from an infected person. It's the most common bloodborne infection in the US. Again, everybody over 18 should be tested at least once for Hep C. Everybody over 13 should be tested at least once for HIV. This stat is terrifying, but and I don't know how it holds up, especially after COVID, but in 2016, the CDC announced that hepatitis C kills more people than the total combined number of deaths from 60 other communicable infectious diseases, including HIV, pneumonia, and tuberculosis. So Hep C is at the top, and the next 60 diseases all the way down, Hep C kills more people than those next 60 combined. And there is no vaccine for hepatitis C. So you were probably vaccinated for hepatitis A and B, but there is no vaccine for hepatitis C, but there is an easily tolerated cure, and every single person in Pennsylvania is eligible. And then my last slide is just if you need any more information, if you are interested in rapid testing or testing by a provider, or any type of care here at Philadelphia Fight, you can give these 2 numbers a call, and we're happy to answer any questions that you have and very happy to take care of you.